Peace and blessings, brothers and sisters. I'm Elder Ramar with the Gathering Christ Church, and I'm coming to you for this video. I wanted to share a situation that's happening, what's going on right now. We have a member of our church, Sister Candace, who is actually has a medical scenario that's going on right now. And there's been some real, I would say, unethical health practices that have been going on from the time that she was first admitted into the hospital. And what I wanted to do was I wanted to bring in her cousin, Sister Tabitha, who is her power of attorney and has been there pretty much for the majority of this medical episode, if you will, as well as other ones that she's had in the past of her current health challenge. She has an autoimmune deficiency, and so some of these things happen, every so months. So I just wanted to bring in her cousin to kind of introduce herself, and we have Sister Tabitha. Are you there, Tabitha?
Hi, I'm here. Shalom, Elder.
Shalom. And so you are your sister Candace's cousin, is that correct?
Yes, we're blood relatives, first cousins. Our mothers are sisters.
Okay, and y'all are you're her power of attorney when it comes to what she's dealing with on a health level.
Yes, I'm her medical power of attorney when she's non-responsive, highly sedated, and can't make decisions on her own. That's when I, by law, have the right to turn down or make any decisions related to her health.
Okay, all right. So just wanted to establish that first. We actually have a video here of some footage that you recorded in the hospital. So I just want to play it so that those out there that watch this video can see just a little piece of what's been happening in and around this medical scenario, this medical episode that she's currently has going on right now. So we're going to play this video, and I'm going to stop it periodically just so that we can get some names of people that are actually involved with doing things that would not be justified under you being power of attorney and making decisions for her on her case. So let me go ahead and play this video for you brothers and sisters, and then after we finish the video, I'm going to bring Sister Tabitha back in, and she's going to basically start from the beginning. I'm going to ask her some questions. She's going to start from the beginning, let us know what all has happened from the beginning of this case all the way up until now. It's very important to know the details of what's going on, because these things will never be told what's going on behind closed doors. Okay, so let's play this video, and we will come back and have Sister Tabitha kind of break down the whole medical experience from when it first started.
Okay, so then don't come in here then if that's the case. But I do not want her moved in as medical power attorney. I'm telling you that I do not want her moved.
I understand what you're saying, but as per our policy,
what's your name?
Precious.
Miss Precious. Okay, so you're moving my sister after I'm telling you I do not.
Okay, so real quick, Sister Tabitha. So we had a Miss Precious, and it looks like she's a nurse. You said that she was what type of nurse?
Miss Precious is the house supervisor.
Okay. She's the house supervisor, so she's like the head nurse for that floor?
Yeah, she's kind of like the enforcer and pretty much, enforces all the rules, the protocols of the hospital.
Okay. And what's the name of this particular hospital?
Baylor Scott and White, Baylor of Plano.
Okay. All right, great. So I'm going to start the video back up, and I'll pause it as more names come out in this video, okay?
Okay.
I want her moved as medical power of attorney.
Yes.
Okay. And what is the doctor who's giving you this order?
Tarzan.
Okay. And how is this? How is this?
Okay, so now she mentioned that the doctor that gave her the order to move your cousin name was Tarzan. Does that sound correct?
That is correct. The doctor name is Dr. Tarzan. Mm-hmm.
Okay, so Dr. Tarzan is giving house supervising nurse, floor nurse, Precious the order to move your cousin against your order. Is that correct?
Correct. That is correct, yes.
Okay, so I'm going to continue playing this video.
Legal? How is this okay? If I'm saying I don't want to be separated from my sister, we can be. I'm requesting to be transported to another hospital,
Which would take hours.
Okay, well we're gonna do that because you guys.
I cannot expose staff or anybody.
Okay, so
Put her on oxygen.
okay, so I don't want you to move my sister, and you're doing it anyway. Okay, and I have medical power of attorney. If I told you, and it's right here.
Have it on record. Go ahead and transfer.
Okay, but you should not be touching her. I've told you that I'm power of attorney, and here are the documents right here, and you shouldn't be touching my sister.
I understand.
Okay, so you're taking her somewhere where I cannot be, correct?
For right now, yes.
No, not for right now. You're taking her where I can't be.
Yes, ma'am.
And you're telling me there's nothing that can be done about it. Correct? Correct? Well, you're not answering, ma'am. You're not answering.
How many people? 5.
Why are you not answering, but you're taking my sister? They're taking my sister after I told them I have medical power of attorney. And they're talking about put her documents on the table. They're trying not to allow me to make decisions for my sister. She can't even answer her name, and she can't say anything. And they are removing my sister, so I can't make decisions for her. And they can do after she's taken 2 COVID tests and they come back negative at a sister hospital, Baylor of Irving. We're at Baylor of Plano right now, and they're still taking my sister. I have the right to do what I choose. Since you're going to do what you choose to do and break the law, I'm going to do what I want to do to protect my sister. I'm so sick of you guys harming her and then separating us, and I can't make a decision about it. You guys say you care about the clients, but you're not showing that you care. It sounds like you're trying to do something to her. So I don't have a say-so, so I don't, at this point,
Dr. Tarzan to be to talk about transferring her, okay?
They're moving her right now. They're moving her right now. Yes, I am. I am. Yes. I'm doing all of this as they're taking her away from me. While I have medical power of attorney. I have it all.
Ma'am.
Yeah. I have it on. I have it all. This is ridiculous. So they're just going to take my sister from me. I'm medical power of attorney without me having a say. How is that? That's not legal. I know my rights. That's why I'm medical power of attorney. They are not supposed to do anything. And then when I asked the house supervisor, is that correct? That's when she stopped answering. Because she knows that this is illegal. Yeah, so I need to see the doctor. This is ridiculous, what they're doing to my sister. When is the doctor going to come in here to talk to me about my sister?
Okay. Can you get your paperwork?
I've already given. You should have asked for the paperwork before you took. And I told you it was right there. You have no right to take my sister without looking at the documents. Oh, my blood is boiling right now. Oh, this don't make no sense. Yeah, I recorded the whole thing from my other phone. It's on video. Yeah, that's ridiculous. They're taking her. Why do they keep trying to separate them? It doesn't make sense to me. It doesn't make sense. The doctor hasn't come in here and said anything to me. The police is actually here. Can I speak to the police and talk about my rights? Are they able to come in here?
So that's just because it's
COVID.
Okay.
Give me your paperwork so I can put it in.
Okay. Yeah, I have the paperwork. Can I leave my stuff here and talk to you really quick, or do you want me to grab everything? Are you not going to touch my... Actually, I'll just take my purse and talk to him because I don't know.
Paperwork.
That's fine. I don't trust that you guys won't touch anything after how you just handled the situation with my sister.
Can she get the paperwork?
The paperwork is in my hand, but I'm going to talk to police officer since you weren't following protocol and look at the documents before you touched my sister.
How many times?
And I was changing and talking to my family. You can't expect for me to make a life-changing decision in 2 minutes and give you the paperwork and figure out what to do with my sister. I have the medical power of attorney in my purse. I was telling you, we're trying to make a decision.
Can I have the paperwork?
You can have the paperwork when I talk to the officer.
Can I see the paperwork?
Yes, you can, and you're going to give the paperwork back to me because I don't trust that they're going to do
know
something with
they
it.
need to make
Physical copies.
That way they have it on file.
Okay, so you're telling me that I will get my paperwork back. This is the only hard copy that I have.
You can make copies. Yeah, we'll get some copies.
Don't. Okay.
We'll get some copies and we'll bring them back to you.
Okay, so can I watch them make the copies?
Yeah, it's right there.
Okay, I can walk with them?
Yeah.
Okay, so while they're making the copies, can I talk to you about what just occurred? Okay,
Can you make copies?
Copy machine's right there, so you'll be able to see it.
here you go.
are medical power
I'm her sister. I'm a medical power attorney. So we just left medical Irving just this morning, right?
Can you do me a favor? Just put your mask
Oh.
on.
Yeah,
She's recording.
Why can't I
we
record?
have a policy against it. I'd love to talk to you, me and my partner.
All right. So, are you with me, Sister Tabitha? You can hear me?
Yes, I'm here.
Okay, so that was the end of the video. Definitely you could feel the tension watching that video. Very, emotionally charged. You have your cousin is being willed out against your order for her not to be. So I can only imagine, what you were going through. And for some people, they may see that video and they may think that really it's no big deal. The doctors are there to help. They're doing what's best for her, even against what you're telling them not to do. But what people may not understand is this is just one chapter of this story. This is actually later in this story. So what I want to do is I want to go back to the very beginning so people can understand what's led up to this point and get the full story, because this is something that's stretched out over a course of days. Am I correct?
Absolutely, since Sunday.
Since Sunday. Okay, so let's first start with your cousin Candace, and just briefly, what is she? She has a condition. What does she actually suffer from?
So she has sickle cell anemia, and it's pretty much like a blood disease disorder. Once it flares up in the cell of sickle, it causes massive pain, and it's unbearable. So she had a sickle cell crisis that started in her shoulder from a steroid shot that they gave her on last Thursday. That's what triggered the entire thing. The shot, the steroid shot, yeah. That's what started the crisis.
Okay, so is this the first time she's had a crisis?
Absolutely not. No.
Okay, so she's had, more than one. This isn't her first crisis, so this isn't necessarily abnormal that this is happening. This has happened on more than one occasion, right?
Yeah, I can't count in my life how many she's had. She's had that many. So none of what she's experiencing is abnormal.
Okay, all right. So let's start back with, you said that she had a steroid shot on Thursday of last week, and then that kind of is what started it. So what led up to, I guess, after the shot, what she started to have a crisis, and then what happened once the crisis came? What happened from there?
So the crisis started in her shoulder. It started to spread throughout the arm and the other arm, and then it went down to her hip area and her legs. That's when we decided to go into the hospital.
Okay, and
We
what day was that?
That was on Sunday
Sunday.
morning.
So a few days
hmm
after the shot, you're going to the hospital. And what hospital was this?
Baylor of Irving.
Okay, Baylor of Irving. So you're there at the hospital. This is something that she's experienced before as far as having a crisis. So, you're going, are you thinking that it's just another day dealing with, or another incident that she's having that you're going to deal with? What all is happening when you get to the hospital and, in the, beginning days of this crisis?
Absolutely. So we go in thinking that, they know that her medical history consists of sickle cell crises. This is really, really normal. So we're thinking that, we're going to go in, tell them the medication she can't have, tell them the medications and the treatment they normally go with. Obviously, they can also see, they have access to her medical history and her treatment as well. So we went in with the thoughts of we would get the treatment as we normally do. We go through the ER like we normally do. Once they check her levels, blood levels, try to get an IV and things of that nature. They run some blood tests. They see that the levels are, really low or really high and that she needs to be admitted. And while we're in the ER, they typically give a lot of medication to help with the pain. And that's exactly what happened.
Okay, so they typically give her medication in this situation. So what medication did they give her?
So at first, they asked her what medication she can't have. So we informed them that she cannot have morphine as well as Tylenol 3 and 4. We explained that she's allergic and morphine makes her go cold blue. So they said, okay. So they asked, they looked through, they noticed that she normally takes Dilaudid. They first said Dilaudid is no longer at that hospital and that we would have to find an alternative. So the doctor said he'll find something else that has similar, ingredients and that would treat her. And that's what he did. So they gave her some medication that's similar to Dilaudid, but then later found out that they actually do have Dilaudid. So they gave her medication prior to giving her the Dilaudid. So she had a mixture of multiple medications.
Okay, so they gave her a different medication than what she normally gets. Do you know the name of that medication?
I can't recall how to pronounce it. It starts with an S.
Okay, so you're not sure of the name.
Yeah.
It wasn't what she typically got. So she didn't get her normal pain med, and from there you're saying that they did have the Dilaudid. Now, did they have it the whole time, or they just happened to find some?
They had it.
Okay.
They had it the whole time. The doctor came in and he said, actually before they gave her the medication, they said, oh, I'm so sorry. We do have the medication. It's just a hospital protocol. I didn't know that there were certain things I needed to do in order to get the medication for you. So I'm going to go ahead and do it so that we can get the medication. Let's try this new medication out, see how you do with it. And then if it doesn't do anything in a few minutes, we'll go ahead and give you the Dilaudid as well, which is what they did.
Okay, so the Dilaudid was there. Now, they told you it wasn't there. Do you know why they told you it wasn't there?
The first thing he said, the first thing the doctor said was, this hospital does not administer Dilaudid. And we told them that obviously that's what they treat her with because the only thing next to it that's just as strong is morphine, and that's what she cannot have. So they tried to find something in the middle, and they did, but they had Dilaudid the entire time. He said he just wasn't aware that there's a hospital protocol they have to follow in order to get the Dilaudid.
Okay. So first thing they tell you they don't have it, and then later they tell you, well, we have it, but we had to follow a protocol before we can give it.
Correct.
So, okay, so we maybe would speculate as to why they didn't just tell you they had it the whole time and tell you there's a protocol to give it. We, unless you maybe know why
Right.
unless you know,
Right.
do you know why they?
No, it was actually I was shocked to know that the doctor came in and told me that, hey, we do have it. There's just a protocol behind it, and it was weird. It was weird. I'll tell you that. Yeah.
Okay, all right. So we'll leave it there. All right, it was weird, but so we can speculate on that, but we'll move forward. So they gave her the other medication, and then they also gave her Dilaudid on top of that.
Yes, they kept giving her Dilaudid on top of it because the pain was really bad. So none of it was working. So they kept giving her medication.
Okay, so they kept giving her Dilaudid. Okay, and then going forward, we're going down the timeline here. So what happens next?
Okay, so they admit us into a room on Sunday, and pretty much they're treating her with Dilaudid as well as Benadryl to help with the itching, and the other medications like fluid, things of that nature. And she's admitted, and they tell me that I have to leave at 8 o'clock. So during the time I'm there, they're giving her the regular treatment of the Dilaudid. They did increase it from 2 milligrams to 4 milligrams every 3 hours because they seen that, she was still in massive pain and nothing was working.
Okay, so keep going down the timeline here.
Okay, so Sunday, we're there the entire day. We eventually get admitted into a room. Once we're settled into a room, they come to me and they tell me that I have to leave at 8 o'clock. That's when visiting hours are over. And so I leave. I go over the medications and the regimen they have in place with her. They assured me that everything will stay as is, which is just the fluid, the Dilaudid, Benadryl every 6 hours to help with the itching, and they wanted to do some, x-rays for the chest and, things like that. So if they needed some antibiotics to help with the infection in her chest, they would do that, which is what they did. So I'm there all day Sunday. I'm there all day Monday. Everything is perfectly fine. On Tuesday, I had to, she was in the process of moving apartments. So being that she was in a hospital, I had to, clean out her apartment for her. So another sister at the church, Sister Patricia, came and in my place for me. So she sat with Candace the entire day on Tuesday. So I spoke with Sister Patricia and I asked her, just go ahead and document everything, make sure everything is, on time, on schedule, because I don't want her to, fall into a crisis where everything flares up because they've been late on medication, because that happened since we were there. They delayed giving her medication and it resulted in her going into, another sickle cell crisis. So I was trying to avoid that. I also informed Sister Patricia, if anything happens, anything new, anything outside of what's currently set in place, to give me a call so that you guys can run it by me and I can tell you yay or nay. In the midst of Sister Patricia being there with Candace, she's going over some information with the nurse. One of the nurses named Sama. They speak about decreasing her dosage because she wasn't responding at all. They tried calling me on the phone on Tuesday so that she can hear my voice. And, maybe she will respond because, it's a familiar voice. She knows my voice and we're hoping that she'll answer. She's not responding at all. She's not saying her name. You can call her name. They were nudging at her. Nothing, absolutely nothing. So her heart rate was increasing. So they were noticing when I would speak to her over speakerphone, she would get calm. So I was staying on the phone speaking to her. They only allow one visitor per day. You can't swap out. So whoever's there that day has to stay there. So I couldn't be there. So I did my best by staying over the phone.
Okay, real quick. You could only have one visitor per day. Now, is that normal standard hospital protocol?
Oh no, that's not standard at all. That's only in place with the pandemic that's in place, the COVID. That's
Oh,
not normal.
okay. So because of COVID, you can only have one visitor per day. This is their rules, right?
One visitor per day with limited hours. Yes.
Okay. All right. Proceed.
Okay. So we find out that they're talking about she's non-responsive. We have to figure out what's going on. They decided to decrease her medication. That's when they said, okay, we're going to decrease, Nurse Soma said, we're going to go ahead and decrease her her Dilaudid, and we're going to take her off of morphine. And so Miss Patricia wanted to make sure she heard what she heard because she knew that's something she was not supposed to have. So she asked again, and she said, how long have you been giving her morphine? And they said they've been giving her morphine since Monday and Tuesday, which would have had to happen after I left on Monday because I was there every time they gave her medication during the visiting hours.
Okay. So
So-
let me get this straight real quick. So you have the first day you're there, you tell them on Sunday that she can't have morphine because she's allergic to it, right?
Correct.
They tell you that they don't have any Dilaudid. They'll give her something else. So they gave her that other drug, the initial drug. Then they came back. They told you, well, we do have Dilaudid, but we have to go through a protocol before we can give it. So then they started giving her
Correct.
Dilaudid. So now she has those two drugs in her system, as well
Yes.
as Benadryl for the itching, right?
Correct.
And then now, a few days later, you're finding out they've also been giving her morphine, which she's allergic to, on top of all the other drugs that are in her system, right?
Absolutely, yes.
Okay, all right, so proceed.
Okay, so Sister Patricia said, I want to clarify that you said that you gave her morphine, and they said, yeah, we've been giving it to her on top of the Dilaudid since Monday and today, but we're trying to wing her off, so we're gonna stop the morphine and we're gonna decrease her dosage of the Dilaudid from 4 milligrams to 2, and instead of every 3 hours, they're gonna do every 4 hours because she was non-responsive as a result of all the medication, the heavy narcotics they had her on.
Okay.
So they decided that she was on the 3rd floor. They said they want to switch her to the 4th floor for no reason. They didn't give a reason. They just said, we're going to switch her to the 4th floor. And they did that. While they were switching her to the 4th floor, Miss Patricia was there. Sister Patricia was there helping them, gathering her things, assisting, putting her in the new room. Then she had a slight fever of 99.7. And the new nurse on the 4th floor said, oh, she has a low-grade fever. And Nurse Soma said, yeah, she does. We're going to do some x-rays. The x-ray says she has some infections, but don't worry, she tested negative for COVID-19.
Okay, so this was Thursday. She had been there since Sunday, and you're hearing...
No, this was on Tuesday. This
Okay,
was on Tuesday.
Okay, this was Tuesday. So she had been there since Sunday, and on Tuesday, you're hearing them saying, the nurse, you didn't hear this. Sister Patricia heard this, right?
Correct. Yes, Sister Patricia.
Heard the nurses talking about that she had taken a COVID test, and she had tested negative for the test, right?
Yes, she's there with them, transferring her beds and all of that. So she's involved. So she's involved in the conversation. She's involved with transitioning her into the room. So it wasn't like a overheard type of thing. She was involved in the conversation. And Nurse Soma said, don't worry about the fever. She tested negative for COVID-19.
Okay, now let me ask you a question. Did you or Sister Patricia give the hospital any consent to give her a COVID-19 test?
Absolutely not. No.
And did
No.
anytime any of those nurses or doctors ask you or mention COVID at any point?
They didn't ask me. No, they didn't ask me, nor did I have any knowledge that they gave her that test until Sister Patricia told me on Wednesday.
Okay, so they were just in conversation, the two nurses, and it came out just through conversation that she had been tested and she tested negative, right?
Correct. Yes.
Okay, so proceed.
Okay. So during the time when they transitioned, visiting hours were over. So that's when, Sister Patricia had to leave. Wednesday morning, I try to go see my sister, and they say she's in isolation. She can't have any visitors right now. And so I'm asking, why can't she have any visitors? At first, they were trying to tell me that it was the floor, like the fourth floor. And I said, okay, well, if there's just a fourth floor, is it like, janitorial? Are they cleaning? What's going on? And because that's what they were trying to tell me. So I said, no, it's okay. I'll wait. However long it takes, I will wait. So I'm waiting around. Nothing is happening. So I asked if I can call up to the fourth floor because I didn't have the number. I only had the third floor number. So I'm speaking to one of the nurses, and they said, no, it's not the fourth floor. It's just that room, your sister's room. She can't have visitors right now. And so I asked, well, why can't my sister have visitors? Like it makes no sense. Well, because of her levels and she's having shortness of breath and her breathing, we think she's at high risk, and we're going to isolate her, and we definitely need to test her for COVID-19. So that was finding out. That was the reason why they transitioned her upstairs without telling me, without calling me, and they made these decisions, even though they had previously tested her without my consent, without telling me, without telling her. All of this had taken place.
Right.
So she's on the fourth floor. They won't let me come visit her. I asked to speak with a doctor so that I can find out what's going on. So obviously it took a very, very long time for me to find out, why I can't see my sister, what's going on. This makes no sense. I informed them that she's been isolated this entire time because she has pre-existing conditions. We made sure of it, that she wasn't in contact, with anybody. She was perfectly fine. The doctor finally calls me, and she says, well, we want to do some tests on your sister because she has shortness of breath. She's having trouble breathing. This is on Wednesday. She's having trouble breathing, and we're seeing some inflammation in the X-rays, and we want to kind of see what's going on. It looks as though we want to test for the COVID, right? So I informed them that the doctor that that's not something I'm willing to do. That's not something I feel is needed. Everything she's experiencing happens every time she has a sickle cell crisis. So what's the need?
Okay, so real quick, at this point, they're saying that they're going to test her for COVID. Now, of course, later you found out that they had already tested her for COVID. So at this point, did you know that she had been tested for COVID once already?
No. At that point, I did not.
You didn't know.
So what happened? No, I did not know. What I did know was that I was not willing to allow them to test her for COVID because they had already isolated her, and I didn't want another excuse of why I couldn't see her. So I contacted Sister Patricia just to give her an update, and that's when she started informing me of the morphine and the COVID. So immediately when she told me that information, I called back, and I was speaking with several different nurses. One nurse confirmed, the other nurse denied. So there was miscommunication. Somebody was lying. I know Sister Patricia heard what she heard. She's very concise, and she's also in the medical field as well.
Let me ask you this. Did you get those two nurses' names that you spoke to?
Yeah, I did. One of the nurses' name was Teresa, and she said that there was no COVID test given. The other nurse name, she didn't give me her name. She was one that actually answered the phone, but Teresa was actually a charge nurse because I wanted details as to why they would give her a test without letting me know, why they're giving her morphine without letting me know. So one of the nurses actually spoke to me about both the morphine and the COVID. By the time I spoke to the second nurse, she said, I don't see morphine in her chart. I said, well, I've already spoken to one of the nurses, and she confirmed that you guys are giving her morphine on top of the Dilaudid. So why is it no longer in her chart?
Okay.
So there was funny business with that. I don't know if someone messed with the chart, removed it once they seen that obviously she's not supposed to have morphine. Whatever the case may be, one nurse is telling me, yeah, they gave the test did come back negative for COVID. And then one nurse saying, no, she hadn't taken her test yet.
So what it appears like to me is we have either a scenario where you have the left hand not knowing what the right hand is doing, or you just have dishonesty and some covering up going on. It's fair to say.
Usually I would say that that's possible, but in the medical field, obviously being in the hospital a lot, everything that's done is documented in a chart immediately. In fact, they have to document it before they do it and confirm they've done it. So there's no way they could have pulled up her information and said, oh, it's not there, or yes, it is there. Either it was there and it was removed. That's the only way that could have happened, because one had already confirmed it and then the other one denied it.
Okay, so what happens next?
Okay, so after that happens, the nurse, the doctor, I speak to the doctor, and the doctor tells me that you're insane. If you don't allow me to test your sister for COVID-19, you won't be able to see her at all, possibly much longer. If you allow me to test her, it'll only be 8 to 10 hours. We'll do it right around, the end of visitor hours. You'll be able to see her first thing Thursday morning. You'll be fine. Just go ahead and let us test her. If you don't, then you're still not going to be able to see her. And I informed her that I have medical power of attorney, and if they continue to not allow me to see my sister, I'm going to have to transition her to a different hospital. I also asked the doctor, what symptoms does she have that's making you think she has COVID? That's making you want to influence you to test her for it. Again, it was the shortness of breath. It was the breathing, the same issues that are related to her sickle cell crisis. I asked the doctor, is any of this abnormal for a sickle cell patient going through a sickle cell crisis? She said, I'm not answering that. I don't want to answer that. I don't want to play these games with you. And I told her, I'm not playing any games with you. I'm asking you a specific question because you're isolating me from seeing my sister and you want to do tests on her for no need. There's no reason. Let's go ahead and continue treating her with the antibiotics as you've been doing, with the Dilaudid for the pain, and let's see if she progresses, which she will. Like I'm telling them, she will get better. This is a fact. This is what happens. They said, absolutely not. We don't want to play those games. She could potentially get worse, and she's putting everybody at risk if she has it. Well, if she's putting everybody at risk, why are you, and if you guys are concerned, why are you going in my sister's room unprepared? You're coming in with no gear on. I mean, if you're that concerned, because she threatened me with that. She said, if you don't let us test her, we're going to come in with the gear on every time we give her medication, and you won't see her. And that's just how it's going to be. So
you're saying that they were going in and seeing her without gear on?
Absolutely. I was there, and they didn't have any gear on. No, they just...
When you say gear, you mean what, like a mask?
Yeah, they didn't have... So, like, now, in the beginning, they just had, like, a regular face mask, and that's it. No gloves, no nothing. Just the mask covering their face. If she was at risk for any type of COVID, and that was the concern, even when they went in to talk to her about it, they still didn't come in with any additional medical gear. It was the same attire. So I don't think they were concerned about COVID whatsoever.
Okay, so you're just saying that based upon their the gear that they had on, it wasn't like it was the hardcore gear that you would expect somebody in the hospital to have on, this a nurse or a doctor under those conditions to really protect themselves according to what they would require or say is protection. They were almost taking it lightly, like it really wasn't anything going on, but yet saying that she could possibly have COVID.
Absolutely. That's exactly right.
All right. So what happens next?
Okay, so I talked to my sister. We kind of figure out what we want to do. She pretty much gave me two options. She said that either you allow us to test her, or she's going to remain in isolation and you still won't see her. She assured me that the test would only take 8 to 10 hours. They would get their results back 8 to 10 hours. If it comes back negative, I'll be able to see my sister again. And I said, we had a conversation. We said, hey, we know you don't have it. They can't give you any sort of treatment without, our consent. Let's just go ahead and, go with it. We didn't want to do it, but that was pretty much the bottom line. Let's just go ahead and get it over with. She's still in pain. Let's just get it over with so that I can make sure she's getting the treatment that she needs,
Okay. So you told them it's okay. Go ahead and do the test so that we'll have access to her. So
Yes.
Okay. So what happens next?
They did what is called a dry swab. Okay. They did the dry swab on Wednesday, and of course, it came back negative. Now, obviously, the test they had done prior, which one nurse confirmed, one nurse denied, saying that it came back negative, that technically was her second test, but I guess on record, let's just go ahead and say that was her first, because that's the one that everyone's confirming. That test came back negative. I go there to see my sister Thursday morning, thinking everything's going to be fine. Spoke to the doctor, the nurses, everything came back negative. Oh, no, ma'am, I'm so sorry. She's still on isolation. You can't see your sister right now.
So
I said, what's going on?
So even after having the which we know, or according to the witnesses, that this is a second negative test
Yes.
For COVID, now they're saying that you still can't see her, even though initially they said, well, once she takes the test, if she's negative, then you'll be able to see her. That was basically the guidelines to be able to see her was let her take this test. If she's negative, you can see her. But now they're saying, well, she's negative, but you can't see her.
Absolutely. That's exactly what happened.
Okay, so then what did she say? What happened from there?
Okay, so I go there Thursday thinking I'm going to be able to see her. The front desk tells me, oh, no, we can't let you up. She's still not allowed visitors. I immediately call. I said, hey, what's going on? I spoke with the doctor, and she told me that after we take this test, she's going to make sure that I'm able to see my sister this morning. And I was there right at 8 o'clock in the morning. So they called the doctor because the nurses said there's nothing they can do. The doctor called me. I said, doctor, hey, what's going on? I'm here. We agreed that once the test comes back negative, which we told you it would, you will allow me to see my sister. She goes, yeah, one test isn't good enough. We need two negative tests. And I said, well, you didn't say that to me yesterday. You assured me if I give consent, we give consent to this one test, and it comes back negative, which it did, we're going to be good to go. I can see her. She then said she spoke to the lung doctor, Dr. Anaconda, who stated that he wanted to do an antibody test on her. That's another COVID test. And then if that were to come back negative, then they would release the isolation. That's when we had to draw the line because we knew they were playing a game at that point. I asked the difference. What is the difference of the test? She goes, well, one was just, we just did a quick swab and we tested and it came back negative, but it's not as accurate as the antibody test. So, yeah, we need to do the antibody test. And I said, well, no, you're not going to do that. They said, well, we already did it. We're just waiting on the results. And I go, when did you do this test? Because you didn't call me And my sister says that she didn't want to take any additional tests. So either you gave her the test without, her being aware that's what was going on. And you didn't call me. So what's going on here? They go, ma'am, she needed to take the test. We need to rule out COVID-19 for sure. So this is the test that's going to tell us exactly what's going on.
So let me ask you this question. That antibodies test, would that have been the third test at this hospital?
Absolutely. That would have been the third test.
That
Yes.
would have been, you would have had the first test that you didn't know about, that Sister Patricia
Mm-hmm.
somehow found out through maybe slip of speech. Then the one that you said, okay, so I can see her. That's test. You said I can see her if she tests and everything tests negative. I can see her. She won't be in isolation. That
Right.
test came back negative. They said that the first test came back negative as well. They said, okay, you still can't see her. We need to take another test, which, according to your understanding, this would now make the third test that they would have to take.
Yes.
They would take for her.
Yes.
Okay.
Yes.
Okay.
So after speaking to the doctors, I'm completely not on board for another test. She goes, "What's wrong with you? You're the only person I know that's against these tests. What are you afraid of? What's the problem?" And I just pretty much let her know that we both agree that the symptoms that she's experiencing are a result of a sickle cell crisis. So it's no need to discuss why we don't want to take another COVID test. So they understand my stance on, no, we're not taking another test. And if this persists, we're going to go ahead and discharge her from this hospital. They immediately get the lung doctor on the line with me to see if that can, change my mind. He's going over her results, stating that she has pneumonia in her lung, stating that infection, bacteria, that sort of thing. Didn't even really mention much about COVID, but stated that because of all of those things, he wants to take another antibody test. Take the test for it, which would have been the third test. And so we informed him that, obviously, Dr. Anaconda, you did this without my consent already. And, Candace is at this point, she's not happy. She's upset. She's crying. That's causing more stress on her body, emotionally, as well as, going through this alone. And they're coming in her room with complete gear on at this point, treating her as though she does have COVID-19. She wasn't happy, and she wanted to release herself from the hospital. She was coherent at that time, so she was able to make that decision on her own. They wouldn't allow me up, so I didn't even have to exercise my medical power of attorney. She actually did it on her own. She had enough at that time, and so she requested to be discharged. They did everything, trying to encourage her to stay. You could possibly die, and saying all of these things. I was on the phone with her, but she let them know that she wasn't comfortable. So that's when she discharged herself from the hospital, Baylor of Irving.
Okay, so because of all the inconsistencies and all of the deceitful dealings and, just things pretty much just not being out in the open as far as what are the true intentions, what are you really doing, what have you done, Candace decided in that moment that enough is enough. I'm not going to deal with any more of this confusion. I want to be discharged from this hospital. Correct?
That is correct, yes.
Okay, so she's discharged from the hospital, and let's proceed down the timeline here.
Okay, so she's released around, I would say noon. It was around noon. They brought her out on this seclusive door. I had to find it. Again, they treated her as though she was leaving as a COVID patient. But we pick her up, and she's doing okay. She's talking to me. She's still, in pain, obviously, but her pain level had went down from so 4 is pretty okay, typically we don't even go to the hospital on a 4. It has to be like an 8 or 9. So she's good at 4.
Okay, so her pain level went from what to a 4?
A 10. We went in on a 10, and she left on a 4.
Okay, so her pain level's down. So she's coming down in pain, and all right, continue.
Yeah. So as she's coming down, her pain level is a 4. They take her off the oxygen, and after the charge nurse has released her, the nurse at that time was, saying, even I can hear, you could die. You can die. This is all why she's bringing her to me. So, I'm talking to her. She's still, pretty high on the medication. Sissy, you're not going to die. The Most High has you, that type of thing. She was just, the nurse was trying to be negative. So we go to my house. So I'm caring for her there. She's lying down, and she's pretty much just resting. I got a humidifier. I put some essential oils inside of the humidifier, and she's just fine. She's just resting. I asked her, do you need anything? She says, no, I'm perfectly fine. Leadership came over, prayed for her, anointed her. She was doing well. In terms of, leaving the hospital, against their recommendation, she was still doing okay. And she was, like I said, she was just in my home, and we were perfectly fine. She did still have some, issues breathing, but again, they were giving her medication she's allergic to. So that's kind of what happened. The first few hours, she slept like a baby. The humidifier worked perfectly. Rubbed her down with some peppermint oil, and, she was okay. Later on in the evening, I noticed her breathing, and her heart rate was really, really fast. So to be on the safe side, I said, let me just go ahead and, call the ambulance to give her some oxygen to help with her breathing, because I know she needed oxygen. And they stated that, previously at Baylor of Irving that she had pneumonia in her lungs, which they didn't show me anything because I wasn't allowed up at that point. So I said, well, if she does have pneumonia in her lungs, I'd rather her, safe than sorry. Let's go ahead and get her some oxygen. Her breathing was really, really fast. And that's exactly what I did. I went ahead and I called the ambulance, and that was around, I guess like 9 o'clock. At night. They get here, they're giving her oxygen, and they put something in her arm while I was not inside of my unit. Now, by this time, Sister Patricia had came over to help assist with Candace. She had the oxygen reader, the heart rate reader, that type of thing, so that we can kind of see exactly where she was. She was, she had her moments where she would jump low, or she would be actually higher, doing better than what she was doing in the hospital, even on the breathing machine. So it was pretty inconsistent, but, I felt as though she was okay. Just to make sure she was okay, I did go ahead and call the ambulance, as I stated, and they came and they immediately gave her oxygen. I stepped outside to call family and to get advice to see, hey, what exactly is the best option here? What should we do? Should we go ahead and, let them, take her in to get more oxygen? Because obviously immediately that's what they're, recommending. They're like, hey, we need to take her in, high energy, that type of energy that'll kind of make you anxiety, try to stress you out type of thing, pressure you. So I immediately felt that, and I made the decision. I said, while they're giving her oxygen, and Sister Patricia is here with them, let me step outside, talk to the family, pray, get my head together, and that way we can make a decision on what's best for her, what to do. So we decided to go ahead and take her to Baylor of Plano, which is the hospital we normally go to, and the only deciding factor was that I can stay with her the entire time.
Okay,
there would be no... Mm-hmm.
There would be no finish your sentence there?
There would be no separation, meaning they cannot isolate her by any means. And they contacted the hospital to confirm that. That was the only way I would go.
Okay, so you got, you know, approval from them through their superiors that if only the terms for you to go to the hospital with Candace, you had to go together and you can't be separated.
Correct. They let me ride in the ambulance. Yes.
Those were the terms. And you said also something about while you were away speaking to family to make that decision, they had stuck a device in her arm.
Oh my goodness. This, I think it's called an IO or IU. This thing they stuck in her arm. Mind you, it's the same shoulder that she just got the steroid shot in. They stuck it looks like a screw. The needle it's shaped like an L. It's not even a straight needle, and it's extremely thick. When we got to the hospital, the nurse told me that they have to screw it in with tools. They can't just stick it in like a normal needle. They had to use screws to drill it in her arm.
Drill it.
They did that in her shoulder.
Okay, so when they drill it in, is it going into the bone?
Yes, it went to the bone. It went to the bone marrow. Mm-hmm.
And did you give
That's
them?
That's the purpose.
And did you give them permission?
No, they didn't ask me. They knew from the beginning that I had medical power of attorney. I made that very clear so that they know not to make any decisions without talking to me. While I was outside talking to family in the church, they did that.
And did you ask
them
did that. Why they did that?
I didn't even know it was there. I didn't know it was there until we got to the hospital.
Right. And when you found out, did you ask them why they did that?
Yes. They said because her sugar was low and they needed to give her sugar. When they told me her sugar levels, they were saying it was like under 30. They used a specific number. But when we got to the hospital, the doctor asked what was her levels. They said, it just read low. So it changed. They gave me a number, but with the doctor, they gave a word.
And still they didn't say, why they had to drill. Usually with sugar, they give an IV, right? So why not just give the IV? Did they say why they, didn't do the IV? Just the regular way?
No, they didn't. They did not. They did not say anything. They just said that we put this in her arm to go into the bone so that we can get the sugar in there. Is what they said.
I've never heard of that. I've never heard of that procedure before for IV.
She's never gotten that ever. I've never heard of it either.
Okay, so what happens next?
So we get to Baylor or Plano through ambulance. We have to wait a little minute for a room to the point where the fire, one of the firemen said, "Did we not tell them that this is an emergency and the status?" So they went and actually got somebody, and they said, "Oh, we're sorry. Just go ahead and go room 12." So we went into the room 12. The doctor comes in. I'm in there with them. It's a lot going on, high energy, a lot of emotion, a lot of moving. I'm emotional at this point. They kind of stressed me out, in regards to my sister's state, which she was fine. She wasn't fine. She was okay, but she wasn't doing as bad. It got progressively worse. Now, I'm thinking that, obviously she's hearing and feeling all of the energy. So it's a lot going on in her room, in the emergency room 12. I'm trying to, talk to my sister because at this point she's still she's not responding. She started not being responsive around 7 o'clock. Okay. So at this time it's around 11 o'clock. They're trying to get, they're trying to talk to her. The doctor did ask her name. She was able to say Candace, so she did respond to that. But that was it. She wasn't responding to anything. Immediately, Immediately, the doctor determines she has too much medication in her. So they gave her narco to reverse the medication that's in her system. Now, mind you, so much is going on. That was the first thing they did. They were able to check her levels, and they were able to quickly determine she has an overdose of medication.
Okay, so she had an overdose of medication diagnosed by the second hospital, the Baylor of Plano. Now, how did she get all that medication in her system?
She got all of her medication from Baylor of Irving.
So the first hospital.
The first hospital. When we left, there was no need for any medication. Her pain was at a 4. She was good to go. She was just resting at my home.
Okay, because we know that she had the first medication that we can't pronounce.
Yes.
Because they said they couldn't give her the what was the name of the
Dilaudid.
second? Dilaudid.
Dilaudid.
Okay, so the Dilaudid, they said they didn't have it. Then they came back later and said, well, we have it. We had to give a protocol before we can give it out. So they gave her the Dilaudid, and then they gave her the morphine that she's allergic to. After at the very beginning, you told her she can't have morphine. So they gave her morphine too. So it makes sense at this point that she would have too much medication in her system. So, the doctor or the nurse there at the second hospital, it makes sense that they were able to, notice that right away. So they said that, and then what proceeded from there?
Okay, so they gave her the narco. Now, what I've learned is that usually it takes 1 dosage. They gave her 3 to reverse whatever medication was in her system. The moment they started giving her, they gave her the first, immediately she started responding more. Immediately she started responding more. She was moving more and, moving things around, the oxygen mask, and, we were able to tell from her body language what was bothering her, that type of thing. She was just more responsive. The more they gave her, the more responsive she was. So that confirmed that it was indeed the medication that was affecting, her ability to respond, to move, to breathe, all of those things. It was due to the medication, the overuse of medication they gave her.
So the narco, as soon as she took the narco, then immediately she started to respond, because at your house, whenever she was there, she was becoming unresponsive, correct?
Correct. Yes. Correct. That is correct.
And now, because this hospital is diagnosed, she's had too much medicine in her system. Now the narco's administered, and now she's responding. Okay, so proceed.
Mm-hmm. So after that, they immediately go to her chart. They go, is she still allergic to morphine? That's the first thing they do, because it's already listed in the system. So they're going over the medications that she can't have, and they're asking, is all of this still accurate? I go, absolutely. They go, okay, I see that you just left Baylor of Irving today. I go, absolutely. They're looking over everything that took place at Baylor of Irving, asking me questions about it, and pretty much comparing what had took place to her current situation. Now, if they could just look at the charts and see that she just left Baylor of Irving and see all the medications and everything that took place, so could Baylor of Irving do the same thing? Why didn't they do that while, instead of giving her medication she's, allergic to? So, okay, they go through, list everything that she can't have, morphine being one of them. Absolutely. The game plan is this. Let's just go ahead and get the medication out of her. They gave her 3 dosages, and, she was, better at responding. Let's keep her on oxygen, get her levels up. We're going to put her on some fluid and antibiotics, and they went ahead and did an x-ray. So we're just pretty much sitting there. She's not in pain. She's not crying, any of that. She's just, she's just there pretty much, we're trying to get her levels back to where they need to be. she started doing better around, I would say 15, 20 minutes, to where the registered nurse, his name was James, he came in and said, oh, you can take her, oxygen mask off. She's breathing on her own, so she's good. A little after, the doctor came back in and said, no, keep that on. So, that let me know, though, she was doing good if the nurse felt as though she can take her, the mask off because she was breathing on her own, which she had started doing in the ambulance. They told me she's breathing on her own, so that's a good sign. So she was doing, her breathing was good. She just needed a little bit of oxygen, some help, and she pretty much was good to go. That's still what they're treating her right now. So this was last night. Treated her with just the oxygen, antibiotics, and the fluid. They did the x-ray. They did say that they see pneumonia on her lungs. And I asked for proof. I asked if you can show me how you're determining that she has, oxygen on her lungs. So they said, okay. So the doctor comes in while we're still in the ER, and she just got a report from Baylor of Irving. They told her that I, being medical power of attorney, discharged her, and they were in the middle of, doing the additional testing for the COVID, and it's my fault, and, she got worse because of me. The doctor. Mm-hmm.
So a doctor comes in and is angry with you for taking her out of the first hospital?
Yeah, she goes, her name was Dr. Deja, that you could have killed her. I just spoke to the doctor at Baylor Irving, and they said that she left because of you. You discharged her. And, she said you shouldn't have done that. She could have died. And, she starts saying some other things, and she stormed out of the room. So I told her, listen, we're not going to do that here. My sister, she only needs oxygen. And if this is the type of energy you're going to have around her, we can go somewhere else, because we just left Madness, and I'm not going to come to Madness again. I'm not going to do this while she's sick. She calmed down and said, well, I'm going to come back and talk to you. So when she came back in, she expressed how she felt based on what they told her. I told her what happened, and she was completely shocked. She also said, the third test that she had, the antibody COVID test, just came back, and it was negative. Negative.
This is the third test.
This is the third test. We left before the results came in, but she said it came back negative. Okay. This was the test that the doctors at Baylor of Irving said would free her from being in isolation.
Right.
Okay? Yes.
Mm-hmm.
She says that the test came back negative. I said, okay, good. So we don't need to discuss this COVID-19. She says, well, you left before the results came in. I said, doctor, please let me explain something. I don't care what you're saying. We've only been gone a few hours. There's no way you're trying to insinuate it's possible she caught COVID within those few hours. Like, we're not even going to go there. So she goes, no, you're fine. I'm not going to recommend any tests. You're going to be good to go. We are going to admit her. I said, perfectly fine. So we were in the ER for a few hours. We got admitted to our room around 4 something in the morning. It was close to 5. Close to 5 in the morning. Yeah, it was a little after 5 is when we actually went up there. So Dr. Gupta was the nurse at the time, and she's talking to me. She says, hey, we're going to, she's on PCU, which is a step lower than ICU. It's not as critical. I think she'll be fine on this level. I don't see a reason to put her in ICU, but if things get worse, we will have to put her in ICU. But right now, she's progressively getting better. I think this is, pretty much where she'll be until she leaves. You're going to be good to go. We're going to continue to treat her with, all of these things. We're going to check her blood levels. keep getting some blood cultures and we're going to be fine. She does have the chest, the pneumonia in her lungs. We're going to continue treating her with antibiotics, but she's going to be fine. Very positive with the game plan and, with the results that she received. This was 5-something in the morning. 8-something in the morning. Sister Asha called me. She's an RN. She attends the church. She was on the phone with me the night prior, so she was calling to check on how Candace was doing. Okay? I'm on the phone with Sister Asha, who is a registered nurse. The doctor, this is a new doctor, Dr. Tarjan, comes into the room, busts in the room, and says, I need to speak with you. We're going to test her for COVID. I'm putting her in isolation. I'm not going for this. That's what she said. Not good morning. She just kind of just went in. I was completely shocked.
Okay.
I was shocked and yeah.
So just real quick, just for my edification and the people who are listening to this video, is this the same doctor that you initially spoke to that was angry? No. The day before. So this is a different doctor busting in with a similar spirit of anger towards you.
Yes.
And she was angry because why? You wouldn't do the COVID test?
No, she hadn't said anything to me whatsoever. Not, hi, I'm Dr. Tarjan. I'm concerned about your sister. Absolutely nothing. Nothing. She said nothing. So she got some information in regards to her results and bust through the room and said, I need to talk to you. I'm taking her to COVID. She's going to COVID and she's having issues. I'm not going to risk my staff. I'm not going to do it. No, she's going to COVID. She's going to COVID. So I'm on the phone. She's going to the COVID floors, what they were saying. So again, I was on the phone with Sister Asha. She's a registered nurse, and she couldn't believe what she was hearing. She said, is that the doctor speaking to you like that? I said, I'm assuming that's the doctor. I don't know what's going on because, mind you, it was 8-something in the morning. We had just got in at 5-something. I had just woke up when I received a call from Sister Asha, checking on Candace and myself to see how we were doing. So I'm still trying to figure out, what's going on. So I see the white coat. So I see, obviously, this is the doctor. So I don't know what's going on. So when she says that, I'm taking her to the COVID floor. She needs to be in isolation. I'm not going for it. Her test, she's talking to me, but she's also yelling in the hallway. She's not even in the room. So I don't even know what's going on. She didn't go over any sort of test with me, any results with me, nothing. So, she didn't say anything.
So she's in the hallways talking loud and angry. Now,
yes.
At this time, what was Sister Candace's status at this time? Was she doing okay?
She was in the same state as the previous doctor said. She's doing perfectly fine. We're going to keep doing what we're doing. So she was fine. Her levels were increasing at this point. She was just, pretty much relaxing. No narcotics, just on oxygen, antibiotics, and fluids. So she was fine.
So she's perfectly fine. And then out of nowhere, this doctor, what'd you say the doctor's name was again?
Dr. Tarjan.
Dr. Tarjan bust through the door saying you're not going to stop us from giving her a COVID test.
Yes.
And
we're taking her up to the 5th floor, and she's going to be in isolation.
Now, this is the same Dr. Tarjan that was mentioned in the video I played, correct?
Absolutely, yes.
This is the one that gave that nurse the order to move her. So this is now getting to the point of the video clip we saw, right?
Absolutely.
Okay,
yes.
so just so brothers and sisters know, like, we've been doing this video, it's an hour, almost 15 minutes in on this video, and we're just now getting to the part of the clip that we showed an hour ago, just to show you how much has happened. And this is the short version of the story. We're talking about almost a week's worth of information being crammed in, in a short time period to kind of give you, hopefully the main points of all of what's happened. And I'm pretty sure there's still a whole bunch of other stuff that's not being said that was going on also. But for sake of time, we're just trying to get as much of the main points in as we can. so that brothers and sisters understand what's going on in these hospitals. So Dr. Tarjan is saying we're going to COVID test her and we're going to move her. Okay, so then what happens?
So I was lying down when she did all of this. All I heard was, removing her, isolation, that type of thing. So Sister Asha said, Tabitha, you need to handle this. You need to see what's going on, know your rights, and just go ahead and handle that. So we hang up. I get up and I open the door and I say, hey, what's going on? I hear someone saying something about taking my sister to isolation, where we just left that situation. That's why she left the doctor. That's why she left Baylor of Irving. And all three of her tests have come back negative. You're saying that you want to move her, but I don't even know who I'm talking to at this point. So right outside her door is the nursing section. I said, I don't know who her nurse is. I don't know who the doctor is. The doctor didn't discuss anything with me. I need to know, what's going on. So by this point, I'm asking to speak to, the charge nurse. So they're like, okay, Miss Precious was there. She goes, I'm going to come in and talk to you in a second. And I go, okay, well, can I speak to the charge nurse? Who's the charge nurse? And so her name was Keely. And so I go, could you tell me what's going on? Because I don't know anything. I don't know why that doctor is upset. I don't know why she's yelling. I don't know what's going on. Because someone please talk to me so I can get a better understanding. But what I can tell you is not going to happen is we're not taking her to the COVID floor. And I hear the doctor, yes, we are. Yes, we are. And so that's when Miss Precious, she's trying to, pretty much diffuse the situation. She asks, let's go in the room and let's talk. While we're in the room talking, mind you, the doctor has called security and the police on me. I didn't know that, but let me just go ahead and go over the conversation me and Miss Precious had.
So police and security had been called on you?
Yes, I had no knowledge of it. I didn't even know that the doctor called police.
Why did they call the police on you?
They didn't tell me. They didn't tell me why. From what I gathered, they thought that I was, they didn't know that I was medical power of attorney, or that I knew my rights in terms of not forcing her to go. Right. So I'm speaking to Miss Precious. That's the house supervisor. She pretty much enforces the rules. She can make exceptions. She has authority on that floor. She's the house supervisor. So she's speaking to me. She goes, well, so her tests are coming back. Dr. Gupta was the first nurse she spoke to when you got up here at 5 a.m, but all of her tests had not come back. And there's some things that are concerning Dr. Tarjan, and she wants to test her to rule out COVID. I said, okay, well, we did that already. And then all of the tests had come back negative. And I was told the most intensive test she took, and that came back negative. She goes, well, she didn't have much information for me. She just said, well, we have to take her, we have to take her down. And I said, well, you can't do anything without my consent. I'm medical power of attorney. That's when she goes, well, do you have those documents with you? And I said, absolutely, I do. And then she said, may I have them? I said, yes, I'll give them to you. Give me some time to talk to my family so I can figure out, what's going on, what to do. So she steps out. So while I'm, gathering myself, I had to change my clothes because, mind you, I was sleeping when she burst in the room. So I was changing my clothes to get, more appropriate, as well as contacting family and leaders of the church to kind of get, counsel on what to do. You know what I mean? Because I'm not giving consent again to allow them to test her. Like, it's like this is the fourth time they're looking to test her. It made no sense.
So let me ask you a question based upon everything and all the testing going on. Why do you think they want to give her so many tests? Do you have any thoughts on that?
Without a doubt, I feel with every being in my body, if we would not have gotten my sister out of Baylor of Irving, I think she would be dead by now. I'm not saying that lightly. I see things on social media and the news. I never thought I would experience it. But being in this situation, I now understand what they're saying and what they go through. I feel without a doubt they would have killed my sister. I feel like they were trying to find a way to relate this to COVID by any means necessary. And they know by isolating her, they can do certain things, which they had done, and, you know, I wouldn't be aware of it. So I think they were trying to do something. It makes no sense of why they keep isolating her and trying to get her to take all of these tests.
Mind you, the whole reason of you agreeing to going to the this particular hospital, the second hospital, Baylor of Plano, was that if you went, the conditions were that you and Candace could not be separated. That was what
Absolutely.
that's what they told you. But now they're looking to COVID test her again. All right, even though this is a second hospital, she has results from the previous hospital. She's negative in 2 that they are admitting have given her, and 1 that they're not admitting, but it came out that, so you know there's been 3 tests. And here we are, they're looking to give her a 4th test and isolate her away from you, right?
Correct. Yes.
Okay,
Yes.
So is there more?
Yeah, I actually asked that very question. I said that was the reason why we came here, was that we wouldn't be separated. So this is not okay. And they go, well, yeah, they told you that in the ER, but that has nothing to do with us. So they pretty much said, yeah, they told you that, but who cares? It's basically, what they were saying. So after Miss Precious steps out of the room, I'm on the phone talking to family as well as, leadership of the church, trying to get counsel on, what to do, because I do not want to give consent for another test. I'm not willing to do that. She knocks on the door again. I was in the middle of changing because she knocks and opens the door. I said, please don't come in here. I'm changing. She was already halfway in, and she puts her hand up and go, oh, I'm sorry, because she saw that I was changing. So I'm talking, and, we're on the phone speaking in leadership, and we're pretty much stating that, we cannot allow this to happen. I'm speaking to Bishop Azan, and, he's like, you have your power of attorney, let them know, stand firm and be bold that they can't do this, and that's pretty much what I was prepared to do. So she knocks on her door one more time, and I say, I need a few minutes. I'm speaking to my family. We are making a decision. The decision was we're going to have to leave this hospital because we can't allow them. She can't be away from me again because I may not get another chance. I may not be able to see her again after they separate us and isolate her. I can't allow that. So we were prepared to say, hey, if you feel as though you want to isolate her, let's go ahead and transfer her to another hospital, which the doctor in the ER told me I had the right to do. So I was exercising my right. If I don't like the treatment I'm getting at this hospital, let's transfer to another hospital. So as I'm on the phone, I'm speaking to my local bishop, Bishop Azan. We're talking about, we're pretty much on the same page with family and everything. Like, no, they can't take her to isolation, and she can't be without someone again. In the midst of that, that's when the nurse, the house supervisor, Miss Precious, comes in, along with the charge nurse, Nurse Keeley, and someone else whom I didn't, notice. And that's when they started coming in with the extra gear on and transferring my sister without my consent. And that's when the video recording began. And I didn't catch the beginning part. Like when they came in, she was saying that we can't put our staff at risk by continually coming in here, and she potentially has COVID. And I said, well, stop coming in here then until, we make our decision to be transferred. And that's when that's when the video started, when I was saying, well, stop coming in here and let us get transferred. So that's when the footage actually starts. It was pretty much right when they came in.
Okay, so we saw that footage and the footage stopped. So what happened post footage?
Okay, so I didn't know, like I said, prior to, they had already called security on me. Once the doctor burst in on me and I said, no, that's not going to happen, she immediately called security as well as the police, not knowing who I was, my position, the legal rights that I have, not asking, knowing any of that. She just immediately called the police. So when I came out, I was talking to Bishop Azan. Obviously, I was really emotional in regards to them taking my sister without my consent, feeling hopeless in that moment, So that's when, he suggested, ask to speak to the police. And I'm asking to speak to the police. And lo and behold, they were right there for me. They had been called on me. So once the video had stopped, I actually started recording on my other phone. It's audio, not the video footage. I pretty much explained that what they're doing is illegal, and I would like to file a claim, a report in regards to how they handled that situation, being that I am medical power of attorney. They didn't have the right to take my sister without my verbal consent. Miss Precious said, well, you didn't give us the documents, and I told her, well, you came in while I was changing and I was speaking to my sister. I reiterated, you don't have the right to move her. You should have waited until I produced the documents and then, had the knowledge of, oh, we can't do anything without her. But no, you moved her and you said the doctor gave you, consent. The doctor doesn't have, a priority over my word when I'm medical power of attorney. She didn't. What I'm assuming is that she didn't think I really had the documents, because when I produced those documents, everybody's attitude changed. When I tell you that the police, he asked me to come into a room, and he asked me, to give my version of what happened. He was very polite, and he appeared to be sympathetic, that type of thing. But also told me that because he was the police for the hospital, they've never filed any sort of report. I said, so how can I have, proof of this conversation and that I would like to file, a claim, a report of this incident because this is illegal? He goes, well, I can give you my card and my phone number and, I'll be happy to answer any questions for you. All the while, I have my other phone going with the audio. So I have that conversation recorded as well as what was taking place at the nurses station. So they eventually call the director of nurses. Her name was Alice. And so Alice comes to talk to me, and they're trying to, pretty much catch her up to speed. This is the funny part. They try to catch her up to speed. She says she looked over everything. Then she comes to talk to me. And she goes, well, yeah, I keep hearing you say something about one test. 3 different tests being taken. No, dear, this is the second test being taken. I said, well, that's interesting because even the doctors have confirmed that there's been at least 2 tests taken. So what's going on with the records? And she goes, oh, my apologies. I only looked at the file for about 5 minutes, so I'll go back and take a look at it. So what's your issue, hon? So I explained to her that you took my sister, and I don't even know why. I don't know what symptoms, what tests you're looking at, what results, what lab work. I don't know anything. And you guys abruptly took my sister after I told you guys not to. So I let them know that I'm medical power of attorney. I walked over with them as they took copies. As long I had the officers walk with me so that they can make sure they don't do anything, crazy to my documents. I informed them those were my only hard copies. So I walked to them with a printer to confirm that, they're taking a copy and hand it right back to me. And that is what they did. And Once we did that, they asked me if I wanted to go back into her room so they can kind of get a better understanding of what's going on and if the doctor can come back in and explain to me. I said the doctor needs to come back into this room immediately and tell me why she rushed my sister off, because I want her to answer to this illegal act. The doctor comes in around 10:30 a.m., okay? And she's trying to go over the information on the computer in the room, but it didn't work. So she goes, here, come to the one out here, which is interesting because she knows that my things are out there, and they had already made it known that I was recording. So ironically, the computer in the room wasn't working, so I had to leave out of the room my sister was in to look at the computer in the hall to go over her results. I still have my recorder on my phone, the audio, I just didn't get video footage. She's going over the results, and she goes, listen, I really care about your sister. I've treated her before. And she's going over all the times that Candace has been there. And she goes, I have a short window. If Candace has, if she has COVID, we only have a short window to help her. And then the ventilator, there's a 30% chance. I said, let me be very clear. There will be no ventilators here. You guys have already given her morphine. You've on top of the Dilaudid and everything else. You're talking to me about ventilator. Why? She goes, well, no, that's what would happen if, you know, she has COVID and all of that. I said, she doesn't have COVID, and my sister needs to be in my presence right now. Like, you need to get her back up here. She goes, let me explain to you, you know, what's going on. I said, why are you trying to test her again when they take into at least 2 tests? She says, yeah, we don't know why they gave her those tests. Those tests mean absolutely nothing. This is all recorded. They mean absolutely nothing. We don't even know why that doctor would attempt those type of tests on her. It makes no sense. Okay? Now this is what the doctor Tarjan is saying about the doctor's request for Candace's test, which would have been the deciding factor of whether she comes out of isolation or not. And that's at Baylor of Irving. She's basically saying, well, no, she did say that test means nothing. It was silly of them to order that test. It's not accurate, and it's not going to help. Okay? So I'm talking to her about everything that's going on in regards to her levels. I said, listen, this is what needs to happen. My sister just needs oxygen, antibiotics, and fluid. She said, that's all we're going to do. I'm speaking to her about the test and everything. She actually, you know, tried to calm down. I think she realized the mistake she had made. Actually, you know, having the documents to prove that I was medical power of attorney, their attitudes changed completely. She's going over everything. And then, you know, I'm speaking to leadership as well. And we're making it very clear. Listen, I do not want to give, I am not giving consent for the test, another COVID test. They tell me it's too late. It's already being done. It's happening right now. And so I let them know that I didn't give consent for it. You took her out of my presence without my consent. And if anything happens, I will be suing and taking legal action. They said, okay, we understand. They didn't seem to care much about what I was saying, not necessarily threatened or bothered. I do know that my sister does need oxygen as well as antibiotics to help with the pneumonia in her lungs, because she did show me that she does have the pneumonia in her lungs. So she's there right now currently being treated with just the antibiotics, fluid, and the oxygen. They can't give her anything else. The turnaround time for the test that they took without my consent is 24 hours. And they also said that she's going to do 2. And I told them, I just want to be clear on record. I'm not giving consent for any of this. And I'm documenting everything. And they said, you know, okay. So right now, that's where she's at. She's being treated with just, you know, those 3 things. And they absolutely know not to give her anything else. And if they do, that's obviously going to be evidence on top of everything else that has occurred in that hospital.
Wow, that is a lot um,
Yes.
going on there with that situation. Now, that's what ended while you were at the hospital, where you ended just now. That's why you were you were at that hospital.
Yeah, they were walking me out. They told me I had to leave the room. So they were walking me out, on the elevator, all the way down to the elevator. I just pretty much kept reiterating, I didn't give consent to this. I don't agree to this. And, I will take legal action if needed. And that was pretty much it because they asked me to leave. So, yeah, that was the end.
Now, have you heard from the hospital since you left?
Yeah, they've actually called me twice to give me an update. One shortly after I left. Actually, to be honest, I hadn't even left yet. I was still there. They told me that she was stable. She had answered a few questions on her own, which validates that she just needed more oxygen, and that they would, give me a call back in a few hours to, let me know how she's doing, and that they confirmed that, she's still getting just the antibiotics, fluid, and the oxygen, nothing else.
Okay, so they confirmed that she's stable and she's doing well.
Mm-hmm. Yes, they said that she's stable. She answered a few questions. She's still, sleeping. And they, obviously they said that the last time I spoke to them was about 2 hours ago, and the nurse, Christine, said that, she's still, she can tell she's extremely sick. She's still restless and just, moaning a little bit, but completely normal when you give someone that much narcotics. Dilaudid is stronger than morphine. They were giving her both at the same time. So that's completely normal, So with everything that's going on with her, liver, they were stating that she has liver failure as well as kidney failure. Understanding how the liver and the kidney works, one trying to fight off the medication, I can completely understand why it's failing. It's, it's obviously trying to fight off the narcotics, the heavy narcotics that they prescribed her, doubling up on the morphine and Dilaudid. So that's the last update I got on my sister.
Okay, well, that's definitely good to hear that at least that's the report we're getting, and the status from the hospital is that she's stable, she's doing well. Now, let me ask you a couple questions here. Do you believe what they're telling you to be true?
In terms of
Her
where
status.
she's at.
Yeah, her status, her condition.
Yeah, I do believe her status. Yes.
Okay, so all right, and at this point, with everything you've gone through with these two hospitals, with all these multiple nurses and doctors, do you trust these hospitals and the people that work in them, the nurses and the doctors? Do you trust them?
No, I do not. If I could replace my sister and put myself in her shoes, I wouldn't go. I would, no, I would stay home and trust in the Most High and do, natural herbs the holistic way. Absolutely not. No, absolutely not. No.
Yeah, because as I'm listening to this story and just everything that you said, I'm just, I would be horrified had you not been there for her. If she was just, probably a number of our people, our sisters who are out there who have nobody, who can easily be taken advantage of in a situation like this. Like you said, you felt like if she had not been taken out of the first hospital, that she probably would not be alive today. So when there's nobody there for our people, and even yourself in being educated to know your rights and the different things that are good, for us to have when it comes to a medical level of administering these things. had you not been there and had the acumen that you had, I'd be horrified to know what they, with what already they have done to her, what more they would have done without you being there or somebody being there to fight for her.
Absolutely. And that's my concern, even now. I'm trusting in the Most High without a doubt. I know the Most High is faithful and He has the final say. It's very draining. I'm exhausted myself. I'm physically, emotionally exhausted. I'm drained. This has been going on since Sunday, and it's only gotten worse day by day. So it's definitely a lot, for sure. I'm glad I made the decision yesterday, telling Baylor of Irving that I'm not leaving without my sister. I'm not leaving the premises without my sister, and praise the Most High, I was able to get her, but we're in another battle, and, I'm just trying to be patient and just wait for the Most High to show out in this situation, but it's definitely draining, for sure.
And I can only imagine. I am a witness to certain parts of this story. Of course, we've spoke with concerns to her and how to handle the situation and certain parts of the story. I did hear the nurse at the Baylor Irving Hospital, the first hospital she went to. I was on the phone with you when the nurse said if she leaves, she's going to die. And
Yes.
just to hear those type of things from a nurse or a doctor, it's just unacceptable, because in that position, your integrity is on the line, because you're dealing with somebody's life. You're dealing with not only somebody's physical health, you're dealing with emotional health, you're dealing with mental health. So to say that type of thing, there's so many more things that could be said. There is a risk if she leaves that things could digress for her. But to say the actual words that she's going to die, not she might die or there's a chance she could die, it was she's going to die. It's
in the tone she said it in. She was like yelling.
Yeah, and it's very appalling that to actually experience this. And then going back to the beginning of the story, I remember the first time I had an experience with Candace with the crisis that she had. I think this was the end of last summer when she had the crisis that I was there
June.
for. Yeah, so
June
it was
of
about a year ago. So I've actually seen this situation. This is not abnormal.
Oh yeah.
Knowing that this has happened before. And I remember this was the Baylor Plano, which is the hospital she's at now. I remember the doctor coming in with an attitude and yelling at everybody in the room and telling everybody, now this is before COVID, right? Way before COVID, yelling at everybody in the room, the energy that she brought. I remember going out in the hall and yelling back and forth with her and telling her, it's unacceptable for her to be talking like this, telling her what she is and isn't going to do. And then you fast forward to Baylor of Plano this time around, and the first doctor you spoke to that got an attitude with you, trying to blame you for why did you discharge her from the first hospital, yada yada yada, and the energy she brought. I actually heard that on speakerphone, so I heard that too, and I thought it was the same doctor the first time that I was at that hospital. I thought it was the same doctor because it was the same energy, same tone, same everything. So it's just it's just amazing to see that these doctors, what they're doing in these hospitals. Now, let me ask you just maybe another question or two before we wrap things up. When it comes to what all is going on here under COVID and whatnot, do you feel that our people, I know you said this, you kind of touched on this earlier, do you feel like it's in our people's best interest that they are going to these hospitals and just for any reason? I mean, of course, you have emergency situations, we understand, But what do you see happening to a majority of our people going into these hospitals ill-informed? Because of course you're, like she said, you're unlike anybody else we've dealt with. Everybody else comes in and they pretty much just obey. They submit to our authority. You're going against the test. Nobody else is going against the test. So you have people coming in and just bowing down with whatever the doctors are saying. Do you think it's in our people's best interest that they're going and utilizing these hospitals?
No, absolutely not. It's like I said, actually being firsthand experiencing what they do, how they take advantage, how they pressure, how they bully with zero symptoms, and how they treat you. Absolutely not. We don't know what they do. Keep in mind, they isolate you. You don't know. I don't know. Even right now, I have to trust in the Most High. We don't know what they give people once they isolate you. No one is your advocate. Nobody can speak for you, not even your medical power of attorney. No, I wouldn't recommend anybody. Again, like I said, if it was me, I would have, the faith to stay home and trust, my family and do whatever I can holistically, because I don't trust these hospitals. They're wicked. And, I never thought I would experience this. And being in this situation has forever changed my life. I've experienced so many encounters, obviously, with the hospitals, with, in and out of my whole life, with dealing with the sickle cell crisis. But this right here takes the cake. This is chaos. It's madness. And it's nothing. It's a part of the agenda. I see it. I'm witnessing it. It makes no sense. I would not recommend anybody going to the hospital. If I can do this all over again, I now know that in the event, she's having issues, oxygen is something she needs. I'm now implementing that to where we have that in our home so we can treat her properly. I hope this is a learning lesson for everybody. If you have any type of pre-existing conditions, that could cause you to go to the hospital, start thinking about the holistic way now. Start thinking about what herbs will help. What will you need to keep you stabilized and at home? Don't go to these hospitals because it makes it worse. She's gotten worse. She's not gotten better. She's gotten worse being in their care, especially when I'm not around. When I'm not around, that's when her health fails. But when I'm around, she gets better. So I'd never recommend, at this point, going to the hospitals. Absolutely not.
Right. So being proactive, getting on top or ahead of the 8 ball, versus being reactive to a situation, having things in place holistically, prayer, like you said, you being around, the energy that you bring in itself is healing. The prayer is healing, and whether our people are coherent or not in a situation like this, they understand and know that you're there. The reason why she's responding different when you're around versus when you're not around. When you have doctors there that are speaking death, you're going to die, and they're speaking with negative energy, and they're doing things to a person without you around. Of course, a person's health is going to digress in that situation. So you spoke about the agendas. So let me ask you just real quick, when speaking about the agendas, and these doctors and what they're doing. You said earlier you felt like they were trying to find a reason to find her COVID positive, excuse me, for whatever reason that could be. And do you believe that there's pressure on the doctors and the nurses from higher authorities or higher powers above them to do certain things? Or do you feel like they're just ill-equipped to deal with this because this is kind of brand new? Society hasn't really dealt with something with these type of measures put in place. I mean, you had the Spanish flu, you had all these different flus that happened over the course of time, and we've never been in a lockdown state in the world like they've done under COVID. So do you feel like there's pressure from the top on these people, and they're just doing their job and they're just trying to make a living and they don't really know what's going on, or do you feel like there's something else going on?
I definitely feel like there's something else going on. I feel like there's pressure. Keep in mind, I'm trying to make, the story really, short. It's way more detailed, way more conversations with different doctors. Without a doubt, I definitely feel like there's pressure. And what I'm gathering is that morally, they can care less. Excuse me. I don't think they care. I don't think it bothers them. I think they would do whatever it takes to meet whatever type of requirements, financial gain, whatever the case may be. I definitely feel like they are on board for the agenda and killing us and targeting Black people. I didn't even say this, but one person came up to my sister when we were getting admitted on Sunday and said, "Do you speak English?" Like just yelling in her face. You know what I mean? Because, she's fair-skinned and you can't really necessarily tell what her ethnicity is. So, yeah, I definitely feel like it's pressure for sure.
Do you feel like there's money involved with some of these implementations of certain things, like doing COVID testing or giving this drug or this device or that device? Do you believe that some of these doctors and nurses are in it for the money?
Without a doubt. Keep in mind, Baylor and Pelino, Baylor of Irving, the doctor told me that the second test, the official second test on record, was the official test that would be needed to remove her from isolation. Once that test come back negative, we don't even have to have any sort of conversation about COVID. It would only be treating her pneumonia on her lungs. We get to another hospital, the same doctor, same status, says, I don't know why that doctor would give that test, but we have to do 2 more. These are 2 doctors over 2 floors, 2 units, 2 wings, and they're conflicting with what they both went to school for and
Right.
what's taking place currently. It does not make sense at all.
Yeah, because you have to. I would just come to common sense understanding that if the second, which we know is the third test they gave, was the official test and the one that would basically be the end of the matter, the conclusion and end of the matter, then what was the purpose for giving the previous test? What was that about? Right? To me, it would only make sense. Let's just give the official test, but maybe there's money involved with the more tests you give, then the more money you make per test. I've heard about kickbacks and these type of things for, different medicine. You have insurance money to cash in on. So, it could be a combination of things. Money, pressure from the top, confusion, nobody really knowing. They're just guessing, possibly.
Absolutely. And I will say that they're very deceitful. When you speak to them, you have to use discernment, and you really have to kind of sit back and see how they move. They will come, very conning, as though they really care, and they'll try to persuade you and try to get you to consent to whatever they want you to do. And the moment you show any type of attitude or verbiage that you're going against what they want you to do, immediately they change. They change. And, for an example, when we first got admitted, they told me, I said, hey, can my pastor come in and pray with my sister? Oh, yeah, no problem. You guys can just swap out. It's no problem. I said, well, it's more than once. So can they, swap out more than once? Yeah, as many as you like, just one in the room. As soon as leadership gets there, oh no, they can't come. No one can come in the room but you. You know what I mean? They switch up as soon as, you show some sort of, I know what I'm talking about. I know my rights. And that's another thing. Learn your rights, because they will try to take advantage and bully you. I'm a female and I was there by myself. They completely tried to take advantage. So it's a lot of funny business going on in the hospitals. And if I can stay away, I certainly will, without a doubt.
So, them trying to, bully you and them, saying, yeah, you can have your pastors come in, no problem. And then people coming in, different doctors and nurses coming in yelling and hostile and angry with you and yelling through the hallways and just bursting in out of nowhere. I mean, it's safe to say, I would say we could easily conclude that this sounds like spiritual warfare is going on in these hospitals.
Oh, yeah.
On a whole different level.
On a whole different, I'm telling you, like, experiencing it, I don't think I will ever be the same. Like, my spiritual glasses are on a whole nother level. They are magnified, especially with these hospitals. Absolutely. It's completely different. And I will say this, in the event something happens and, someone needs some sort of medical attention, it is imperative to have people around you who are full of faith, because that spirit of fear jumps and it can change the dynamic of the situation. I experienced that as well. So definitely have people who have faith and, who's going to trust in the Most High and remain calm, because those energies, those spirits, they jump, and that can change, the emotions, whatever's taking place in the room. So that's something, you're going to have to be strong, when dealing with those situations.
Wow. Well, this has been a very a powerful interview, and I definitely appreciate you coming on. Real quick, is there anything else that you would like to share to those who would maybe hear this video that hasn't been covered already before we conclude?
Absolutely. This situation has, helped me to realize that I don't have everything in order as I thought I did. Anybody that it's in your family that has any sort of pre-existing conditions, I don't care if it's something as small as high blood pressure, what they're doing to people in the hospital, they're relating everything to COVID, and obviously they want to get certain drugs such as morphine in their systems, and then next thing you know, you don't have a say-so because, they belong to the hospital. Get your medical power of attorney. Get your documents in place. Get hard copies. Have copies in your email so that you are covered and protected with your loved ones. Also, like I said earlier, make sure that you do your research now. What could you take at home that could prevent you from going into the hospital? Do that research now. I wish I had, thought about all of this sooner. I wish I had oxygen, already at home. I now know, I thank the Most High for, this learning lesson. And I hope everybody, learns from this situation and just get prepared properly, because it's not pretty. It's really ugly. It's not over yet. My sister is still away from me. I'm trusting in the Most High, right now. And, it's exhausting, but learn from this situation and do what you can. Get your powers of attorney, medical powers of attorney, look up the medications, and, and get everything in place now so that you know what your rights are, because they're going to try to persuade you. So know what your rights are, get everything in place, and just stand firm and be bold when you speak to these doctors and nurses.
Hey, I mean, that's definitely, being that you've been through it, you've definitely been through a lot of years with Candace, with her, her health challenges, and now under COVID, seeing how it's, taken to a whole nother level than it was in the past. And now you have that experience, so you can actually share with other people out there to not, fall victim to the same, snares that that you unfortunately have gone through with this experience. But we definitely appreciate this interview and everything that you shared. We'll continue to keep Candace in prayer as we have been, and continue to give her the care that she needs, the help that she needs, and we'll also continue to keep you in prayer and uplifted with your strength and endurance through this, being there for her, being her voice, being her fighter for her in the time when really there's nobody else there that can fight outside of the Most High God fighting for her, but here in this realm. So, it's important that you are in your, place of health, emotionally, mentally, physically, to be able to be there for her. So we'll continue to keep praying for you also. And
The water, much appreciated. Thank you.
absolutely. And just to the brothers and sisters out there listening, as we conclude this video, we tried to make it short, but as you can see, there's a lot here to tell and still a lot that hasn't been told. But hopefully it's been edifying for you and well received. I would just leave with these words that it's important to, stay informed, stay watchful, stay prayerful, and take heed.